We have our first presentation of this IDS 2023. We are very glad and honored to have here Mr. Terry Whitty from Sydney, Australia. Terry is a dear friend of Shining 3D since many years, and now he is going to share an amazing presentation to display the full digital solution, the integration between Shining 3D and software related to orthodontics. And I will pass the microphone to Terry that will explain much better than me. Thank you very much, Terry.
Thank you very much, Ricardo. How is everyone today? It's nice to see you, and what a buzz is going on at the Shining 3D dental stand. I think it's incredibly busy, and why wouldn't it be, with two fabulous intraoral scanners, a new face scanner, the wireless scanner of course, and that's not to mention the 3D printing equipment as well. So what I'd like to do today is, I thought I would just start off with talking about digital dental scanning, what's new from Shining 3D. Please come and have a look, hassle the people here, get your face scanned, get your mouth scanned, try it out, see how it works. And then I'm going to just briefly touch on the new Maestro 3D orthodontic software. That's what I look like when I haven't had a shave. So that's me at home. That's where I live, in Sydney, Australia. Who's been there? Anyone been there? No, you've been to Sydney. Oh, that's good. Please come down. It's not too far away, only 22 hours from here, so that's okay. When I'm not doing this sort of thing, I actually do this for a hobby. So I play rock and roll, that sort of stuff. I'm actually the author of over 200 articles. I'm very proud to be able to say that. They've been published all over the world, and I'm more than happy to say that. We also have it's like a YouTube channel called dentevents.tv, and you might see me around the IDS over the next 4 or 5 days doing interviews with different people. So pop that down in your book. Okay, so what I like to call it is the digital revolution, or the intraoral scanner revolution in dentistry. And it is a revolution because things have happened rapidly over the last 5 years, the last 3 years. And of course, we know that if we go back in time, back to 1983, that's when the first intraoral scanner was developed. But intraoral scanning solves a massive problem that we have in dentistry, and you can have a look on the screen and you will see that that's actually the massive problem that we have in dentistry. Traditional impression taking, less than optimal. So it solves that problem. Once you solve that problem, you solve all the extra time, effort that you go in to try and fix these things. Impressions are not ideal. And in some cases, yes, they may be able to be used, but in my opinion now, I would say that all of the intraoral scanners on the market are good enough to take over, and especially the Shining 3D ones. What's one of the biggest problems we have with impression taking? Here's a good example. When we actually start to take the impression, if we have a look here, we're actually pressing the tray. So this is the tray on the outside. You can see this here. This is the tray. There's our yellow is the impression material, and we're pressing the tray and it's flexing, if you have a flexible tray. Once we take this off, we actually have distortion. So that's a big problem. We don't suffer that when we have intraoral scanning. So our digital dental workflow that we would like to talk to you about today is, we need to actually acquire some data somehow, and then we're going to use a CAD program of some sort to do designing, and then we're going to manufacture with either 3D printing, milling, or a combination of both, or whatever else is new coming out. So with acquisition, the really important thing about it is that these days it's far more accessible than it used to be. What do I mean by that? What I mean is that, let's face it, the price has come down. The quality has gone up, the price is coming down. Let's have a look at this graph. Everyone likes graphs. Let's have a look at price over time. And you will see that the price of intraoral scanners has come down. And lots of people, lots of customers might say to you, oh, you know, I'm going to wait till the price of them comes down. Well, they've come down. But inversely, the performance of intraoral scanners has gone up. So we've got price coming down and performance going up. When you have these two things together, then obviously we really are in a position now where nobody has an excuse not to have an intraoral scanner. If you have a dental surgery, then you should have an intraoral scanner. Preferably you should have one like this. That would be good. Of course there's lots of others on the market, but have a look at this one. There's the new wireless one too. By all means have a look at that as well. What are the summer features? Well, speed. Everyone wants to know how quickly an intraoral scanner works because, let's face it, time's money. Come and have a look on the stand, test it out for yourself. Some people have a full arch done in about 15 seconds. Now, is that practical in the mouth with every patient? Probably not. But if you can't do scans in under a couple of minutes, upper and lower scans under a couple of minutes, then something is wrong. Accuracy. This is something that people ask me about all the time. And when we look at accuracy, we want to know what accuracy is, but I will tell you now that in most cases, an intraoral scanner is fine for any dental application, and I'm going to show you some of the applications shortly. I can't think of anything that it's not suitable for these days. And some people might go, oh, what about full arch implant? I'm going to show you a solution for that. Powderless. Powder is a thing of the past. I haven't used powder for a long time. I just don't use it. Full color. It's nice to be able to see what we're actually scanning in realistic color if possible. Not always the case, but generally we are moving toward the rendering of these scans, is improving all the time, getting better and better and better. What's really good about scanning these days is that it's actually incredibly easy to do. Whereas years and years ago, it wasn't so easy, it was cumbersome. But now, you pick up a scanner, anyone can do this. And I've trained many people on intraoral scanning. And basically I say, pick up the scanner and start moving around. Now, of course, there's ways we're going to actually do scanning that are going to be more productive. But generally speaking, you can actually pick up the scanner without any training at all and start scanning. So it's actually quite easy to do and then easy to master and get better and better at it all the time. The Shining scanner has two tips, one small tip, large tip. So if someone's got a small mouth or you're doing children, you can use the small tip, and then you've got the larger tip as well. The AI function is getting better and better all the time. That does things like if you accidentally scan a cheek or scan a tongue, it's going to take away all that. And it's going to help you a lot. It's really going to help you a lot. One of the other things I like, where we are from, we don't have any ongoing fees for the scan. Once you buy it, it's yours. That's it. The other thing we want to talk about is the software. The clinical toolbox is amazing. So we'll have a look at that as well. The health report, the ortho simulator, the dynamic bite, the cloud service, the 3D printing, and of course now there are some new features, and you need to come and have a look and have a talk to the staff here and have a look at some of the new features they've got in the software. Speed, it's like a bullet. Like the oral scan, wireless and the corded is like a bullet. It scans so fast, it's making people very, very worried. There's a color scan. That's what I do. It looks pretty good. I think it looks great. The accuracy. A lot of people are talking about accuracy. Here is a, for the International Digital Dentistry, Institute of Digital Dentistry. And they picked up four different brands of scanners, and their summation was that all of the scanners were very accurate. The Shining scanners there as well, all of them were very accurate. No one really failed the test. So when people come and say, oh, is it accurate enough? Yes, absolutely it is. Powderless, we don't use powder anymore. It's done, finished, full color, fabulous. It's easy to master, intuitive too. So it's actually quite easy to do. There's the picture of the small and large tips I was talking about. Have a look for yourself as well. AI driven, AI is everywhere. So if you can program, you can put in data, and you can program and have that data to draw on and learn from, then that's going to help. The more scans you do, the better. Non-ongoing fees. So in my part of the world, we don't have any. have a look at the clinical toolbox, some of the features that you have, and by all means, please come to the stand, have a look, and see what it can do. We've got undercut checking, bite checking, margin line auto extraction, tooth marking, coordinate adjustment, and direct exporting to Exocad, which is very, very important. We can work with other programs very, very easily. The oral health report is good. I have a friend of mine who's actually my dentist, and the first thing that she does now is she gets her scanner when someone sits in their chair, and she scans, and she does the oral health report with them. First thing she does. So it allows you to have a look at various different problems such as calculus, tooth alignment, spacing, missing teeth, and teeth defects, things like that. It will suggest a remedy for the problem as well, in layman's term, which is actually quite good, because we want to give this to the patient. We want to give it to the patient and have it as like a reinforcement. You've been to the dentist. Now we're going to download this report to your smartphone. And then it will suggest some solutions. And of course this can be monitored by the dentist as well and adjusted accordingly. The ortho simulator is amazing. I love just playing with this. So if you get on the stand, come and have a look, just have a play with the ortho simulator. It's very, very cool. What it allows you to do is does automatic segmentation of the scan and allow you to do different virtual setups. It will show you things like interproximal reduction areas. It's very, very clever. Come and have a look at it. You could do things like, let me have a look what this setup would be if I extracted the upper fours. It will do that amazingly quickly for you. So once you've segmented, you've got to have a look at this. You've got to see this to believe it. It's fantastic. It's all part of the software. So there's no extra part. It's actually all part of the software. Here's another very, very cool feature. Once you've done the ortho simulation, you can get the patient's smartphone and say, here, just scan this QR code. It is then automatically downloaded to their phone. So they can take it home, show their friends and family and say, I'll have a look at this simulation. Again, I suggest it's a simulation. It's not the real world. It's a simulation. It's something that may or could happen. But it's a very cool feature. There it is on the patient's smartphone. So if you've got Android, Apple, you just scan that QR code and down she comes. Another screenshot. This is a feature that I have been playing with recently. I really like it. I think it has amazing potential. I think it's going to, I'd hate to say revolutionize the way we do things, but it's going to definitely make a massive impact in what we're going to do. What it will do is we'll record the jaw motion, and we call it the dynamic bite. So after we have taken the upper and lower scans and we've taken a static bite, we can do that. We can take a dynamic bite and have the patient go into lateral excursions, protrusion, and that's what you end up with. Now, where does that take us? It takes us to a lot of places. This can be directly imported to your CAD software, like Exocad, and then in the future we could do things like have special 3D printed articulators custom made for the patient. So when the technicians are doing restorative work, we have custom made. I'm not saying this happens now, but I can see it happening very, very soon. There's a product called XSnap, which is a custom made 3D printed articulator. It won't be long until this is actually going to happen. That's the dynamic bite. You have the cloud service. Okay, don't be worried about losing your data again. There's nothing worse than your hard drive failing or your USB stick failing. Nothing worse. It's all going to be up in the cloud waiting for you. So when you go log in onto another computer, all your cases are there. They're there for you. You want to download them, you can download them. So you might be remote somewhere in another surgery somewhere, and you can log in there and you can get all your cases. And now with the wireless intraoral scanner, that makes it a lot easier. Let's have a look at it. The other great thing about the intraoral scanner is it works seamlessly with the new Shining 3D L4K and L4Ds. You can print a lot of different things on these printers. Surgical guides, models for aligners, models for crown and ridge work, splints. You can do third-party resins, but I just thought I'd mention the printer. And of course they have the new Fab Wash. Have a look at that as well. The new lab scanner. Have a look at that while you're here as well. So another way we have to have a acquisition. It's a 5 megapixel scanner. Fabulous for implants. Dentures, digital dentures are a big deal at the moment. Fabulous for that as well. Takes an articulator, just as the others in the DSEX range does. Triple tray. So we'll scan impressions as well. Here's just a few of the things you can do with that scanner. These are the applications. The DSEX Pro H. High definition. So digital dentistry is not possible without this type of acquisition. We need to acquire the data somehow. We don't have any data to go in, we cannot continue. So either an intraoral scanner or a lab scanner. And lots of people will ask you, well, what can we do with it? Once we've got our intraoral scanner or we've got our lab scan done, what can we do with it? Well, fix prosthetics. It's just, that's the norm. That's what we would normally do. Different types, crowns, bridges, inlays, onlays, veneers, all that sort of stuff. Implant retained restorations, of course. Full arch, can we do full arch? Yes, I'll talk about that very shortly. Of course, it integrates directly with the CAD software, and of course, Exocad is the CAD software Shining partners with. You can do implant planning, so you could take your DICOM, load your DICOM into ExoPlan, and then take an intraoral scan or a lab scan, and then merge the soft tissue model. You can print your implant guide with the Shining 3D printer. Here's a little bit of a concept I came up with called the digital scan appliance. So when we're doing a edentulous, say all on X or something like that, and we need to work out how we're going to do a surgical guide. Sometimes we don't have anywhere to be able to put our markers in. So what you can do is you can scan the patient's denture, and if they don't have a denture, you can make up some sort of a bite rim or something like that, and scan that. And once you've scanned that, and the intraoral scanner will scan 360 degrees. Australians. Yeah. And then what we can do is we copy that, we print that out, and then what we can do is we can use a radio opaque paint, which we can make up, and we paint the teeth and we put fiducial markers on it. You have a look, I've actually put markers on these. And what that allows me to do is then merge that with a DICOM. So the patient goes off with those and takes a cone beam scan with those in place, and that allows me then to merge that correctly to a DICOM. Let's go back and have a quick look at that again. So we scan the patient's denture, we do a copy denture, 3D printed, we put fiducial markers in place, and then we can merge that directly with a cone beam scan of that patient. Here's another application we can do. We call it the digital bleaching tray. And a lot of people might say, why would you want to do that? Well, because you can. So we have a model, and then we can make reservoirs. We can do some editing and make reservoirs in our model using, this has been done with Exocad. We can then make our digital bleaching tray. You can print that out. And if we have a look at what we've done here, in the cross section, we've got nice little reservoirs for our bleaching material. And that stops it getting,
Print the bleaching sheet directly, or you have to suck down?
You can print it directly. Yeah, you can print it directly. And you can print it exactly with the reservoirs that you want, and it will seal around the gingival margin, so you don't have any seepage of the bleaching material down into the gingival sulcus. So that's why I came up with it. So you can exactly have a reservoir suitable for the bleaching material that you want. There's lots of different materials on the market. I use Colgate. Alright. Colgate Platinum. So yeah. But there's lots on the market. So there's your digital bleaching tray. That's actually a slide from before we were merging. Okay, so removable pros we can do. There's lots of people I know that are scanning and making their removable pros directly from their intraoral scanners, especially partial dentures and full dentures as well, because that's moving along very nicely. So there's lots of different ways to manufacture it, all coming from the scan. So we've got full dentures as well. Here's Exocad full denture module. 3D printing, milling, whichever way you want to manufacture it. Splints. Yep, here's Exocad again. We're doing splints. Beautiful splints there. Some people call them orthodontics. Splints, you can do them. So we have lots of different things that we can do once we've acquired the data. There's so many different things we can do. This is a milled splint, but you can print them as well. This is done in high density PMMA. Sleep appliances, you can design different types of sleep appliances. So once you've got your data, your scans, your bite registration that you want to use, you can do sleep appliances of all different designs. And some people ask me, which is the best one? The one the patient will wear is the best one, usually. This one is called the digital EMA appliance. So this has been 3D printed. We can do all this sort of stuff. Full arch is a challenge. Full arch is a definite challenge, but there's a product on the market which you can have a look at. I'll show you a picture of this now, because these are some of the problems that we have with full arch when we're using an intraoral scanner. But here is a novel product. Not sure if they're here. They probably are. You can go and have a look at it. But I came across this product. I thought this was a great idea, even though I thought of it many years ago. So what we're doing is we're actually going to, when you've got a scanner and you need to scan across an arch with multiple implants, you need the scanner to be able to stitch with the next one. And that's what this allows you to do. That's got a blank slot. So you can get an on-the-spot bite, record verification with this product, and then a physical. So what you do is you actually use composite resin and you bond this together. You take it out and then you put it back in. And if it fits, it's verified. And then you can have a virtual verification too. So you transfer that into Exocad or what other program you may want to do. This is called Tectonic. You might want to look them up. I'm not sure if they're here. So they've got some really good ideas. So there's lots of different methods to be able to do things that were not so possible not that long ago. So with orthodontics, what can we do? Well, so of course we can do clear aligners. I'll talk about Maestro 3D in depth shortly. Indirect bonding of brackets, so that's a big deal. Now we can also do the merging of the roots of the teeth from a CBCT scan, and we can take that and bring it in. So we've actually got the patient's real roots, and then once we've done our virtual setups, we can see where those roots are going to move to. Very important when we're doing aligner therapy. We can do and also when we're doing bracket therapy and doing virtual setups with the brackets and having a look at that. So we can take an arch, we can do a full setup, have a look where the brackets are, see where our roots are, and then make indirect bonding trays. So these are 3D printed indirect bonding trays. They come in lots of different designs. This is just one design. So with the new Maestro version 6, it does a lot of the things that it used to do, but some of them it does a lot better. And the Maestro works seamlessly with the Shining 3D lab scanners and also intraoral scanners. It does automatic segmentation of the teeth. And again, as I said, you can take a cone beam scan, a CBCT, and digitize the roots and then merge them to the crowns of the teeth as well from the intraoral scan, which is actually quite cool. And then we can do our virtual setup. So in this picture, we're actually seeing that we've got the virtual roots. There we go, very good. Okay, not too long. It has a new articulator, which is very cool. It can do two things. It can do virtual extractions and it can do virtual pontics. So it does the inverse. So when you're doing your setups, you can actually extract teeth, or you can actually put teeth if teeth are missing. So let's say, for example, you're congenitally missing laterals, you can put them in. And as you make your sequence of aligners, they get bigger and bigger automatically, which is really cool. It's a good feature. Yeah, like I said, we've got, we can actually put virtual teeth in, or we can do virtual extractions. Of course, we can move teeth around, do our virtual setups. It has a library of attachments, and you can make your own custom-made attachments as well. So if you've got an STL file of a attachment that you might like, because there might be something that you want to do, you can add it to the library, no problem at all. You can make attachment templates. So if you want to do, you want to place the attachments, you can make the attachment templates here. We've got, this is for acid etching. So this is for etching. It's an etching template. It has the model builder, which is included in it, and that creates a series of models. Yes.
Superimposition, or what's that you can see what's the before?
Oh, okay, fine. I'll explain what this picture says. So we have the before, and then we have the after, and then this is superimposing before and after. And on the side, we can work out our movement overview, and we can work out how many aligners we're going to use, and how much torque, tip, rotation, yeah, that we will do. Yeah.
Software, or have to get the Maestro 3D?
Yes. Yeah. So it's a software, self-contained software on its own, and it's through Shining 3D. Yeah. So they're like a major reseller of Maestro 3D. Yes, absolutely. You can use. Yes, yes, you can. Facial scan as well. So you can use facial scan as well, and you 2D pictures, 3D. Yeah, everything. You can even you put the patient's head in there. Yes, you can. You can re-articulate as well. Yeah. So I would see the dynamic bite being able to be used, CBCT, roots, all this sort of stuff. It's not far away. If it's not done yet, it's not far away. Excuse me. So when we're doing printing, it will do a whole bunch of processes that helps us with our 3D printing. I mean, I'm just walking, I've only just got here this morning myself, and I'm looking around going, oh, there's lots of people printing aligners. But we're still printing models for aligners as well. So this software will actually do that as well. So straight down to the Shining 3D printer. And yes, the software actually creates models and creates virtual aligners ready to print as well. So you can print the model or you can print the aligner. Yeah. Yeah, so that's, and It also will, if you've got machines that cut the aligners for you, it will do this as well. Yeah, it will do the cutting line. Yeah. Yes. Of course, indirect bonding with brackets in lots of different ways. So there's many different ways that it will work. But this is just a very simple overview I thought I would do. I've got 40 minutes, I've done 35, so. And a fantastic report you can give the patient. Once you've done a setup with them or doing brackets or whatever, you can give them a PDF document which is very detailed. It's also got a new bite splint module in it as well. So they're trying, and Smile Design. What software is not complete these days without Smile Design? So everyone wants Smile Design. And yes, I could see Smile Design coming from the facial scanner as well. So 3D Smile Design. There we go. And this is a very, very novel approach to making digital dentures. So it's like a template that you 3D print, and then you put your carded teeth in, and then you can finish off doing your denture. Yeah. It's a novel way to do it. I'm not sure if I'm going to use it, but it's a very novel way to do things. So that's some of the upcoming features in version 6 of Maestro 3D Dental Studio. So what's our summary? My summary is very simple. You've got many possibilities. We need to get the data in, manipulate the data, and there's not really much we can't do with appliance manufacturer restorations these days. I'm happy. You must be happy. You're happy. Yeah, that's me when I'm older. The revolution begun. Get into it. Thanks very much, everyone.
Oh, it's a very nice presentation.
Good, thanks.
So I work with Jennifer